We want to switch gears and ask you about prices, drug prices. Your company, GoGoMeds.com, helping people with the high cost of prescription drugs, and that's what the president was talking about. He mentioned it yesterday. Listen to this.
The drug companies, frankly, are getting away with murder, and we want to bring our prices down to what other countries are paying, or at least close, and let the other countries pay more.
What about that, Ron?
I think President Trump's attention to drug pricing has actually resonated with drug manufacturers already. Just in the last year, in our business, we've seen more companies offer payment discount cards and coupons to people that have to pay out of pocket. So I think without increasing regulation, President Trump's talking about the issue has caused the drug companies to address the issue, and frankly, companies like ours and others showing price transparency on the internet so people can see what they can pay and what they can get medications for is all helping the exact situation he's talking about.
So how does that work, for example? Because these drugs are so expensive. So
You've got some of the lowest prices, though,
right? So you have the ability just to let people see each price out there? Or?
Right. So in our business, the best value for employer groups or the individual person is generic medications. So the generic medications are really what drive great value for the American public. The brand name medications are the ones that are extremely high, but in a lot of cases, they need to be high for the drug companies to recoup the research and development that they've put. So there's a fine line, and the industry works with the FDA, really working together with the FDA to maybe not lower regulations, but that would help drive down costs, is the FDA and the industry working together, which they have been.
How about this point that the president talked about, the fact that you can get American-made prescription drugs so cheap overseas, and Americans end up subsidizing people in Canada and Europe because their prices are regulated in ways that ours aren't. How do you fix that?
Well, that's where I mentioned having price discounts and the coupon cards that we're seeing more and more just within the last 12 to 24 months. I think that's a step towards that, seeing lower prices here in the United States.
You're launching your online pharmacy today.
Right.
Tell us how GoGoMeds works.
So GoGoMeds.com is the ordering site for Specialty Medical Drugstore. Specialty Medical Drugstore is licensed in all 50 states, plus Washington, D.C., and we exist to offer patients and customers price comparison, plus ordering the medication online after we receive a prescription from the physician, and the consumer receives that medication next day if they order next day air, or within 2 to 3 days if it's through regular mail. So I think internet pharmacy is a nice option for consumers in the future that will be in combination with the retail stores, either independent or chain.
Yeah, and look at this tweet that the president, we want to bring you this breaking news. President Trump just tweeted this. He says this: Representative Tom Marino has informed me that he is withdrawing his name from consideration as the drug czar. Tom is a fine man and a great congressman. Who do you want to see as drug czar? Ron Ferguson. What should that person have in terms of the skill set? I mean, what would you look for as the drug czar?
Boy, I guess being a pharmacist, I tend towards wanting a person who has knowledge on treatment. Let the law enforcement take care of fentanyl and heroin coming from Mexico and China, but the drug czar having excellent reputation in drug treatment is what I would advocate to President Trump.
And by the way, I loved your question to Ron in the commercial break about being a pharmacist.
Right. There's a shortage of pharmacists. Talk about that. For viewers out there, is this a good occupation to get into, and how do you do it?
And there's real equal pay in the pharmacy business.
There is. I try to promote to young people, if you enjoy chemistry, biology, and you enjoy helping people, because you have to have a desire to help people, give advice to physicians, So pharmacy is a good field for both men and women.
There's a shortage of pharmacists right now?
The shortage is, there is.
Medical personnel in general.
Medical personnel in general. You know, when we look at, I read where the population over 65 is going to double by 2060.
Yeah.
So the healthcare profession in general is a nice area to be. And even though the pharmacist situation has eased, there's still plenty of jobs for young people looking at pharmacy as a career.
We talk about that every Jobs Day, actually, every month, because that's where the demand is. Nurses, medical personnel, pharmacists. Ron Ferguson, good to see you, sir.
Thank you for having me.
Thank you so much for joining us this morning.